Hello, my name is Dr. Dewan S. Raja. Today I will discuss about anatomy of the testis. The testis is singular, plural is testis, is the male gonad responsible for producing spermatozoa and hormones, particularly testosterone. It is suspended in the scrotum by the spermatic cord. Testis is surrounded by several layers. Tunica vaginalis, the outermost covering derived from the peritoneum, which has two layers, the parietal and visceral layer. This layer reduces friction between the testis and scrotum. Okay, in case of hydrocele, fluid may be deposited in between the tunica vaginalis parietal layer and the visceral layer. Okay. The tunica albuginea beneath the tunica vaginalis is a tough fibrous capsule that surrounds the testis. It extends inward, forming septa that divides the testis into lobules. The testis is divided into around 250 to 300 lobules by fibrous septa. Each lobule contains seminiferous tubule. This tightly coiled structure are the site of sperm production. We call it spermatogenesis. Each lobule contains 1 to 4 seminiferous tubules. Seminiferous tubules are where sperm is produced and matured mostly in the epididymis. There is beginning of maturation, but maturation is completed is in the epididymis. So seminiferous tubule contain two types of cell. One is Sertoli cell or sustentacular cell. Another is spermatogenic cell. The sustentacular cell, they provide support and nourishment to the developing sperm cells, and they also form the blood-testis barrier. Spermatogenic cells, these undergo various stages of development to become mature sperm cells, spermatocyte, spermatids, and eventually spermatozoa. Okay, so if we look at this image, this is a very simplified image from the Google image. You see the testis here, and these are the seminiferous tubule. They contain spermatogenic cell as well as Sertoli cells. Okay, so from there, going through that, we'll get head of epididymis, body of epididymis. Then we'll get the vas difference or ductus difference. This is the tunica albuginea. This is the visceral layer of the tunica vaginalis. Here, this is the visceral layer of tunica vaginalis here, and this is the parietal layer. Okay, this is the seminiferous tubule, this is the lobule, and then you get retitestis in the mediastinum testis, efferent ductule, head of the epididymis, body of the epididymis, tail of the epididymis, and from the tail we'll get the ductus difference or vas difference. Here it is more simplified. Okay, and this is spermatic cord. By the spermatic cord, the testis is suspended in the scrotum. We are seeing the content of spermatic cord, the ductus deferens, the Pampiniform Plexus vein, and the testicular artery here. Okay, so we got the lobules around 250 to 300 lobules. Each lobule contain seminiferous tubule. In the seminiferous tubule, we will get Sertoli cell and spermatogenic cells. Okay, retitestis, the seminiferous tubule, converts into a network of channel called retitestis. This retitestis collects sperm from the seminiferous tubule. Sperm means spermatozoa tubules and directs them towards the epididymis. Efferent ductules from retitestis, which is present inside the mediastinum testis, Sperm pass into the efferent ductus, which transports sperm to the epididymis for storage and maturation. So, spermatic cord is suspending the scrotum, suspending the testis in the scrotum. This is scrotum. This is the testis. Okay, this is the spermatic cord. This is part of the Pampiniform Plexus of vein. Eventually, we'll get the testicular vein on both sides from the Pampiniform Plexus veins. This is a transverse section to the scrotum and testis. We are seeing the lobule containing the seminiferous tubules. We'll get the ductus deferens here. We'll get the Pampiniform plexus of vein here and the epididymis here and here. This is the visceral layer of tunica vaginalismus, parietal layer of tunica vaginalismus. It contains only a few milliliters of serous fluid. The fluid is too much, we call it hydrocephalus. This is a clinical condition. Okay, we got that. Now we'll go to the epididymis. Epididymis, technically not part of the testis itself. The epididymis is a coil tube located on the posterior aspect of the testis. It is crucial for the maturation, storage, and transport of sperm. It has head, body, tail. Interstitial cell of Leydig located in the spaces between the seminiferous tubules. Leydig cells are responsible for producing testosterone, which is crucial for the development of the male secondary sexual characteristics and the regulation of spermatogenesis. Okay, so we got the interstitial cells of Leydig that produces testosterone hormone. Now we'll go to the blood supply of the testis. Blood supply by the testicular arteries, one on each side of the aorta. This artery supplies blood to the testis, and branches form from the abdominal aorta. They are branches of the abdominal aorta. Pampiniform plexus of vein, a network of vein that surrounds the testicular artery, helping regulate the temperature of the testis by cooling arterial blood before it enters the testis. The Pampiniform plexus gradually condenses into testicular vein. In the superficial inguinal ring, there will be 4 veins. In the deep inguinal ring, we have only 2 veins from the Pampiniform plexus vein. As it goes up in the abdomen, then inside the abdominal cavity, we'll get 1 testicular vein. The right testicular vein opens into the inferior vena cava. Left testicular vein opens into the left renal vein. And the left testis is a bit lower than that of the right testis. And chance of varicocele is more common on the left side of the scrotum than that of the right side. Nerve supply of the testes. Testes are supplied by sympathetic nerve arising from segment T10 of the spinal cord. From the gray horn of the spinal cord, they pass through the renal and aortic plexuses. Nerves are both efferent for the testicular sensation and efferent to the blood vessel. So they are vasomotor. That means sympathetic is vasoconstrictor. Lymphatic drainage. Lymph from the testis drain into the lumbar pre-aortic and para-aortic lymph node, approximately located at the level of lumbar vertebra 2. Key function of the testis: spermatogenesis, the production of sperm within the seminiferous tubule, hormone production. The Leydig cell produces testosterone, which regulates spermatogenesis and contributes to male secondary sexual characteristic. Clinical point: descent of testis. Testis during the fetal life, embryonic life and fetal life, it is in the abdomen. Then it gradually descends down through the deep inguinal ring, inguinal canal, superficial inguinal ring to the bottom of the scrotum, suspended by the spermatic cord. Sometimes it may not descend, we call it undescended testis, and that is called cryptorchidism. It may be in the inguinal region, maybe in the abdomen. Okay, so cryptorchidism may be associated with sterility if it is bilateral, but this is associated with testicular cancer. And that's all about the anatomy of the testis. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.